Adrenal crisis. Patient arrives for their routine dental appointment. The hygienist reviews the patient's health history and reads they suffer from Addison's disease. She questions them on how they are feeling and the status of their disease. The patient states they are feeling okay today, but have been feeling and experiencing mild abdominal pain over the past week. The hygienist takes their vitals, finds that the blood pressure is low, but not alarmingly. She begins the prophy, and within 30 minutes, the patient starts to experience an adrenal crisis.
Hello, good morning, Miss Nicole. How are you?
I'm doing alright, how are you?
I'm doing fantastic. My name is Monica. I'm going to be your clinician today.
Okay.
Reviewing your medical history. See that you suffer from Addison's disease. How are you feeling?
I've been okay. My stomach's been hurting for the past week, but other than that, I'm good.
Okay, let's take your blood pressure and your pulse. And how was traffic today? Coming here?
It was okay.
Was
Yeah,
it?
not too bad.
Oh, fantastic. Excellent. Your blood pressure is a little low. It's 85/55. Are you okay?
Yeah, just my stomach hurts, but I'm okay. I'm good. I really need my cleaning done today. Yeah, I'm
okay.
good.
Okay. Let's start your cleaning. If for any reason you need me to stop, we stop.
Okay.
I'm going to put my equipment and I'll be right back.
Okay.
And to put your chair down. Nicole, we're going to do your prophy today. If anything you feel weak or anything, you let me know.
Okay.
And we stop right away.
Okay.
Open it, please.
Oh, I don't feel good. My stomach
What
is really
happened?
hurting.
What happened? Tell me.
My stomach.
Oh, I'm going
I
to
feel
dress
really
you.
sick.
I'm going to dress your chair.
I feel like I'm gonna throw up.
Oh, can you breathe?
Yeah.
Are you okay? Let me get some help. Somebody help, please. Somebody call 911.
What are you doing?
And the oxygen, please. Thank you.
What's the matter? Is there an emergency?
Yes, please call 911. Please, oxygen. It's going to blow in your nose. Breathe slowly through your nose. Let me check your blood pressure again. And I'm here with you. Help is on the way. Be calm. Breathe slowly, naturally through your nose. Everything will be fine. Tell me, what are you feeling? Exactly, what are you feeling?
Just really sharp pain, and I just feel sick to my stomach.
Do you feel tired? You feel your muscles weak?
A little bit, yeah, and I'm getting a headache.
Okay. The paramedics will be here soon, and they will take you to the hospital just for a checkup, okay?
Okay.
We're going to monitor your blood pressure, still a little low, and
Stage 1 of adrenal crisis. It is a life-threatening condition that occurs when the body is severely lacking cortisol, which can occur in one of two ways. One scenario is that the individual has not yet been diagnosed with adrenal insufficiency and is now to a point where the body is in severe need of cortisol to maintain normal carbohydrate and protein metabolism, as well as to help control the immune system. It is common that it can be unrecognized in its early stages and cause other disorders such as gastrointestinal illness or psychiatric disease. Stage 2 of adrenal crisis. The second scenario is where the patient is placed in a stressful environment where the body requires additional cortisol, but is unable to produce the necessary amount. In many instances, individuals who are on corticosteroid therapy, use of exogenous corticosteroids for long periods of time for conditions such as lupus erythematosus or asthma, will experience a reduction in ACTH production and eventually atrophy of the adrenal cortex will occur, necessitating an increase in glucocorticoid dosage. This scenario can lead to an increased likelihood of adrenal crisis if the adrenal encounters a stressful situation. Signs and symptoms of adrenal crisis. Signs and symptoms of adrenal crisis include fatigue, lethargy, muscular weakness, headache, cyanosis, confusion, fever, nausea, vomiting, abdominal pain, hypotension, tachycardia, diaphoresis, sunken eyes, dyspnea, and dehydration. Adrenal crisis, preventive procedures. Stressful situations, including dental treatment, can trigger an adrenal crisis whose primary symptom is severe hypotension. Therefore, patients who have been on corticosteroids during the last year or are currently suffering from adrenal insufficiency may need to temporarily reintroduce or increase their corticosteroid therapy when stress is anticipated. Consultation with the patient's physician is essential to determine the appropriate course of treatment. Profound anesthesia during dental treatment and provision of post-operative analgesics will help reduce the stress of these patients and reduce the likelihood of an adrenal crisis. These patients should wear a bracelet or carry an emergency medical information card that indicates the diagnosis, medications, and doses, as well as physician to call in the event of adrenal crisis. Adrenal crisis treatment options. Management of an individual suffering from an adrenal crisis requires stabilization until EMS arrives. The airway should be maintained, vital signs should be continuously monitored. If the patient is experiencing dyspnea, oxygen should be administered at a rate of 2 to 5 liters per minute via nasal cannula. EMS will likely begin intravenous sodium chloride and fluid therapy to replace fluid volume and correct sodium deficiency, and then bringing them to the hospital.